Good afternoon, everyone. Good morning to those of you who are out west. Welcome to the 5th session of the Queen's 2020 International Institute on Social Policy. The conference this year, as most of you know, is a series of moderated online webinars. So thank you very much for joining us. My name is Margaret Biggs and I will be your Queen's host today. It's unfortunate that we're not able to meet in person on the Queen's campus this year. But even though we're not on campus, I would like to acknowledge that Queen's University is situated on the traditional territories of the Anishinaabe and the Haudenosaunee, and we're very grateful to be able to learn on their territories. If you have participated in our first 4 sessions, you will have heard us mention that this is the 25th anniversary of our Queen's Summer Institute on Social Policy. This Queen's Summer Institute has been probing the most pressing social policy issues facing Canada and other OECD countries for 25 years. But as we heard repeatedly over the last week, at no time in the past 2.5 decades has social policy been so front and center in our national debates and so critical to the future of Canada and other OECD countries. The current crisis has exposed stark inequalities, the precarious nature of work, the lack of basic social security for many. And this conference is about exploring the major and social economic impacts of the current crisis, the implications for critical building blocks of our social safety net, and recommendations for how Canada and other OECD countries can build back better. The first 4 sessions and the presentations and the discussions are posted on our conference website, and I encourage you to take a look at them. They've all been really excellent. Yesterday, we had an amazing panel on rethinking income protection, and the discussion covered issues such as a universal basic income, reforming employment insurance, an expanded Canada Workers Benefit, how to deliver income benefits, and much more. And interestingly, they got into a discussion of the care economy and the importance of care as it relates to people's labor market participation. So it was a great segue into today's discussion, where we're going to focus on rethinking social protection and the care economy. I can think of really no one better to introduce our panelists and moderate this session than Janet Menard, who is the Deputy Minister of the Ministry of Children, Community and Social Services in Ontario. Her ministry is at the forefront of the social protection and care issues that we are going to cover today. Janet has been a long-standing Deputy Minister in the Ontario government. Her previous responsibilities have included women's issues, community and social services, and poverty reduction. And this follows 40 years of experience in the field of human services in Peel and Halton regions and the City of Toronto. So let me introduce Janet Menard, and she will be our moderator today.
Thank you, Marg. Been able to tune in to every one of the sessions thus far, and it has been a great discussion. Said today's topic follows nicely what we've already heard. Before I introduce our panelists, a couple of opening comments. This is of significant interest to me following my learning over the past several months working in the OPS. Early in the COVID-19 pandemic, as part of the Ontario government response, we formed a multi-ministry vulnerable persons committee tasked with identifying high-risk situations that required support to prevent infection and manage spread. Building on what was happening in long-term care and retirement homes, we quickly identified persons living in congregate care settings as high risk and as such our priority. Surprisingly, there are 62,000 residents and 53,000 staff in 4,800 locations across Ontario that support vulnerable people within congregate settings. And this is aside from long-term care and retirement homes. But they do include violence against women and emergency homeless shelters, residential homes for children and youth, in child welfare and youth justice, adults in correctional facilities, children with often complex special needs, and adults with developmental disabilities, just to name some of the largest. In preparation, in addition to prevention and infection control, our third priority was workforce stability. For the most part, no surprise, the workers in these settings are part of the care economy. They're paid low hourly wages They often work for more than one employer and move from facility to facility. They're mostly women and immigrants and persons of color, as has been used as a term through the last sessions. And the risks to them were high and remain high. In addition, they likely also provide care to people at home and are concerned about infecting their loved ones. So thankfully, with one significant exception, we were able to keep the number of outbreaks low and the infection control procedures have been effective. But there have been active cases, and 500 of the staff out of the 53,000 that provide services were infected with COVID. So these employees, however, got us there. They got us to a place where the infection rates are low. And as at the end of August, we have 15 locations with active caregivers. They're tired, they're stressed, they're undervalued, and as you'll hear, underpaid. So throughout the experience, it has highlighted the critical role of our economy, but also its fragility. So I'm really anxious to hear what our panel has to say today, and look forward to engaging in discussion after the fact. So let me now introduce our speakers. Our first speaker is Ito Peng. She is a Canada Research Chair in Global Social Policy at the University of Toronto and is a world authority in global social policy, specializing in gender, migration, and care policies. Andrea Doucette is a Canada Research Chair in Gender Work and Care, a Professor of Sociology and Gender Studies at Brock University. She's widely published on care, fathering, parental leave, and the politics and ethics of knowledge making. And finally, Samir Sinha is a passionate and respected advocate for the needs of older adults. Dr. Sinha currently serves as the Director of Geriatrics at the Sinai Health System and University Health Network in Toronto. So welcome to all of you, and I will turn things over to Ito to kick us off. Thank you very much.
Thank you very much, Janet, and thank you very much to the organizers of this a very important and exciting conference. Let me now just share my PowerPoint slide. Here it is. Okay, in this presentation, I would talk about the impacts of the COVID-19 on care work, and the care economy. And I would discuss this from a global comparative perspective. Whoops, I'm not having the, okay. So the COVID-19 pandemic has exposed at least 4 things in relation to care. First, it exposed our economy's extensive dependence on care. And this has been made clear, for example, by the physical and mental health stresses and losses of productivity and incomes incurred by working parents who had to manage work, care, and homeschooling all at the same time as at home during the lockdown period. And as well, similar stresses and economic losses incurred by working adults who had to care for their older relatives and sick or disabled families and friends while working from their homes. Second, the pandemic has also exposed our hitherto disregard and neglect of care's vital contributions in supporting productive economy. As the examples I just mentioned showed, this pandemic has made people and government really understand the importance of care and care work in underpinning healthy and productive economy. Third, the COVID-19 has also exposed the previous existing and entrenched social, economic, gender, and racial inequalities. This is because, as Janet has mentioned, much of the care, such as childcare and elder care, has been traditionally provided for free by women within the households and in the community. And partly because of this, the market valuation of care work is very low. As the market assigns low values to care work, this in turn results in care work being largely assigned to marginalized workers, such as women, people of color, and immigrants and foreign workers. Again, these inequalities were already there before the pandemic, but the pandemic has clearly made it more visible, and it has also further exacerbated these inequalities and exposed the vulnerabilities within our social and economic systems. Finally, the pandemic is forcing us to rethink economy and the need to seriously integrate care in our economic thinking and in economic theory. But before I go on to elaborate these points, let me quickly define what I mean by care economy. I define the care economy as the economic sector related to the provisions of care and services for people of all ages, both frail and able-bodied. Broadly, it includes healthcare, education, and personal, social, and other services, all of which contribute to nurturing and reproduction of the past, present, and future labor force. And it includes both paid and unpaid work done in formal and informal sectors. By unpaid care sector, what I mean is the work that's been done within the households and the community by family members, relatives, friends, and etc. And by paid care sector, I mean paid work such as public and private care, health, and education services that includes both formal and informal paid workers. I know that my definition of care economy is very broad. So for the purpose of my presentation here, I am going to focus more narrowly on child care and long-term care, or the care of the older people. Now, most people know that today paid care service sector is one of the fastest growing economic and employment sectors globally. In the US, for example, direct care work such as personal care aides, home help aides has been growing faster than any other occupational groups. So much so that today it is the largest occupational group, surpassing retail sales. In Canada, the service sector now makes up 72% of the national GDP and nearly 80% of total employment. And within this sector, care-related services are the fastest growing subsector. So we know that paid care sector's economic contribution is big and growing. But what about the unpaid care? What is the economic value of unpaid care? The economic value of unpaid care work, of course, varies from country to country, depending on how much time women and men spend on unpaid care work and how much care services such as childcare and long-term care are available and provided by public and or private sectors. The latest calculation based on the Time Use survey puts the value of unpaid care work ranging from 2.1% of the national GDP in Kazakhstan to 41.3% in Australia. In Canada, it represents 25.6% of GDP. So this is not insignificant. The ILO estimates, using data from the 53 countries in 2011, they show that the unpaid care work amounts to 9% of global GDP. This represents a total of 11 trillion US dollar in purchasing power parity. Of this, women's unpaid care work came to 6.6% of the global GDP, or 8 trillion US dollars. and men's came to 2.4% or $3 trillion US. Earlier in April, the ILO estimated that the global lockdown measures had affected 2.7 billion workers, or about 81% of the global labor force. In the most recent estimate, ILO calculates that during the first quarter of the year, approximately 5.4% of the global working hours, or equivalent of 155 million full-time jobs, were lost relative to last quarter of 2019. But as the COVID-19 spread after April, working hour losses for the second quarter of the 2020 relative to the last quarter of 2019 were estimated at 14% worldwide, or equivalent to 400 million full-time jobs. Analysis showed that COVID-19 has impacted women more than men. And this is because, again, first, women are more likely to work in service industries, which have been more adversely affected by COVID-19. And as a result, women are at more risk of losing jobs or having their hours reduced. Second, at the same time, women also account for larger proportion of frontline workers, particularly in health and other care service sectors. So if they continue to work, they are also at higher risk of contracting COVID-19. The UN report projects that the COVID-19 recession will result in long-term decline in women's income and labor market participation. Now, since the beginning of COVID-19 pandemic, there has been a number of studies done to see its impact on the family's unpaid care work. For example, Adam Prassel and her colleagues' comparative studies of the US, UK, and Germany found that during the COVID-19 pandemic, having care responsibilities, particularly childcare, was positively associated with job loss in US and Germany. They also found that amongst the working parents, mothers working from home spent considerably more time homeschooling and caring for children than fathers working from home in all three countries. Similar studies were also found, similar studies in UK also found similar outcomes. We also did a survey of family care work in South Korea and found similar outcomes as well. We found that the parents were spending more time doing childcare as a result of the child care center and school closures. And like the US, UK, and Germany, in Korea too, mothers spent more time doing the childcare than fathers. Our survey also found that this increased stresses and anxieties amongst working parents and particularly working mothers. Now, I'm going to skip this figure, but I want to show you the preliminary results from the South Korean survey that we did in July and August. Our team undertook a survey of care work during the COVID-19 social distance measure in South Korea. South Korea, I should mention, did not have a full lockdown measures. Instead, the government imposed what they call social distancing measure for 2 months in March and April. During this time, schools and childcare centers were closed, but most of the businesses remained open. And during this period, because of the childcare and school closures, many parents were forced to work at home. Some businesses, of course, allowed their workers to work from home either full-time or part-time. We undertook an online survey asking respondents about their situations during the social distancing measure period. We surveyed a nationally representative sample of households, a total of 1,252, consisted of parents with at least one child between the age of 0 and 12. Now, this figure that you see shows that because South Korea did not have a formal lockdown measure, most people continue to work. But nevertheless, some workers, particularly women, became unemployed and had to find another job because of the reduced income. This figure shows the length of time people took working from home. And you can see it's clear that fathers were more likely to take short time out of their office to work at home, but mothers are the ones who took longer period of time working from home. When we asked people if they had any concerns about working at home due to childcare, most fathers said that they were not very concerned, but more than half of the mothers were concerned. And when we asked people to explain in more detail the nature of their concerns, the most common answers we got were, first, that they were worried that their employers might think that they are actually not working while they're working at home. And secondly, that they were worried that by working at home, they will incur some kind of penalties afterwards in forms of bonuses or salary increase or job promotion. And when we asked our survey respondents whether having work from home and care for their children have made them consider quitting their jobs, you see that the majority of fathers did not consider, but more than half of the mothers did. What these preliminary findings show is how the COVID-19 have impacted on the work and care of men and women with small children in South Korea. Even though the period of social distancing measure was short, it nevertheless affected families both economically and psychologically. But the impact of COVID-19 pandemic on the family's care burden was not limited only to childcare. Families who are caring for their older family members or relatives were also seriously impacted socially, financially, and psychologically. For example, studies found that in the US and Canada, many families moved their older family members out of the long-term care homes so that they could care for them at home. And this is because they feared that COVID infection in the long-term care homes and of the worries that their older relatives will not be able to receive adequate care under the lockdown condition. Studies in EU and Europe and Japan also found families had to provide more care for their older members because of the COVID-19. Now, I don't have a lot of time to go into detail of the ways in which COVID-19 pandemic has exacerbated the pre-existing gender, race, and class inequalities. But I just want to quickly show this figure from Brindell et al.'s work in the UK. Their study found that women, young workers, people working in low-wage sectors, and racial minorities were disproportionately and adversely affected by the COVID-19 pandemic, as they were more likely to quit jobs or get laid off. The figures you see here show that there were twice as many women key workers or the equivalent of essential service workers in Canada. There were twice as many women working in that sector as men, and that these women are 4 times more likely to work in health and social care sectors compared to men. Also, you see in these figures that racialized groups, in particular Blacks and other Asians, were overrepresented in health and social care sectors. So let me just summarize here the key learnings from the COVID-19 pandemic. As you can see, the COVID-19 pandemic has exposed care work's vital contributions in supporting market economy and promoting economic growth and development. And that it has exacerbated the pre-existing social, economic, gender, and racial inequalities all along the care line. And that we really need to integrate care in economic thinking and economic theory. I am going to sort of stop after this slide. But as you can see, the COVID-19 pandemic has clearly exposed many of the cracks and problems associated with our pre-existing social and economic systems. But I just want to end this presentation with a positive note. I think the COVID-19 pandemic can provide us an opportunity to rethink and change these broken systems. And to do this, we must first rethink care and care work and the care economy. We need to integrate care into our economic thinking and in our macroeconomic policy making. And to do this, we must start with what I call the 4 R's of care: recognize it, reduce it, redistribute it, and revalue it. Second, we need to start working towards developing a more coherent and effective national care systems that includes both childcare and long-term care. And to do this, we need to support workers and families with care responsibilities. We need universal social care systems that provide equal access to quality care, both for children and for older people. And we need to invest in social and care infrastructures. That means putting more money and effort in developing social care systems. In the process, I think we need also to reevaluate the work of care. And finally, this will involve not just social policy, but also labor market policies and other policy reforms that would better integrate the care economy. So with that, thank you very much.
Thank you, Ito, for that. That was terrific. Thanks for describing the care economy and reminding us of both aspects, both paid and unpaid. And because the workers are women who play both roles, the inherent inequities and burden on the caregivers and their families that result. And also for quantifying the value to society and our economies. In fact, our absolute dependency on the care economy. So I will thank you and turn things over to Andrea.
Thank you, Janet, and thank you, Ito, for laying that out so beautifully. All right, hello, good morning, good afternoon, welcome everybody. Unprecedented. That is the word that keeps popping up in the stories that we tell about this pandemic. Unprecedented times call for unprecedented responses. There are many ways of thinking about these unprecedented responses, and 2 of these underpin my talk today. A first response involves taking seriously the gendered experiences and impacts of this pandemic. One huge impact, as Ito has laid out, has been on women's employment, which in Canada has gone from an historic high to its lowest level in 30 years. A concise and provocative gendered response comes from Armin Yalnizyan, economist at the Atkinson Foundation. Her words have been repeated and shared over and over again over the past 5 to 6 months. There can be no recovery without a she-covery, no she-covery without childcare. A second response is to think about how at extraordinary times such as these, we need new stories. And here I want to draw on my esteemed colleague, Peter Moss, Professor Emeritus at the University of London, and one of the world's leading thinkers on childcare, early childhood learning, and parental leave policies. Moss argues that it's time to develop new stories, transformative stories. He writes that new stories can offer hope that another world is possible, a world that is more equal, democratic, sustainable. My work follows and builds on Moss's invitation to make new transformative stories, but I also respectfully extend it. Pulling from narrative and philosophical theories, I use the concept of social imaginaries as a way of thinking about layers of stories and narratives, including policy narratives. I borrow the concept of social imaginaries from Canadian philosophers Lorraine Code and Charles Taylor, who emphasize that social imaginaries are social in the broadest sense. They are higher level stories that make other stories, ideas, practices, and policies possible. They constrain what can be thought or told, what is deemed important, valuable, measurable. As Taylor writes, quote, "They are easy to forget because once we're all installed in a social imaginary, it seems the only possible one, the only one that makes sense." So we live with many social imaginaries, and there are always social imaginaries emerging at any one time. The social imaginary that I want to address today is still dominant social imaginaries of divisions between paid and unpaid work. And so what I'm going to do in the next 15 minutes or so is a presentation that's divided into 3 parts. Part 1 is on new social imaginaries of interconnections between paid work, care work, and paid care work. So this builds really nicely on Ido's presentation. Part 2 is on childcare policies. And here I draw on my role as project director and principal investigator of a new SHIRP partnership grant on reimagining Canadian family policies, specifically childcare, parental leave, and employment policies. Many of Canada's leading childcare experts are part of this grant, and I'm sharing with you today some of my reading of their ideas and recommendations on childcare. Part 3 is on parental leave policies, and here I'm speaking from my writing with 2 of my former postdoctoral fellows, now colleagues, Lindsay McKay and Sophie Mathieu. And just a note for brevity in this presentation, I mainly use parental leave as a broad category for maternity, paternity, and parental leave benefits. So what are these dominant social imaginaries of paid and unpaid work? For me, one of the most succinct ways to articulate this comes from the work of Marilyn Waring, feminist economist from New Zealand. In her best-selling book, Counting for Nothing, What Men Value and What Women Are Worth, Waring recounts how after serving as an MP for almost a decade in New Zealand, in 1984, she took a 2-month research fellowship at Rutgers University in New York City. She had just one aim: to learn more about the United Nations systems of national accounts, the UNSNA, and one of its core measurement apparatuses, the GDP. She describes her visceral shock. She wrote, "It still makes me gasp for breath," when she read one passage in the 1953 founding manual of the UNSNA. It was the passage that drew a production boundary as the dividing line between those productive activities that would be included in the national income and those that would not. What was excluded? Unpaid work of all kinds was left out of these accounts. Across the world, women did the majority of this work. So Waring concluded, as she gasped for breath, that women's work is of little or no importance. It's important to add here that since 1953, there have been 3 revisions of the UNSNA, but unpaid work and unpaid care work are still not included. So how could we think about this differently? The work of Ido Peng and others who write about care economies articulate new social imaginaries that recognize the value and centrality of care, but also the intra-connections between paid work, unpaid care work, and paid care work. One of the clearest and simplest visual depictions of this new way of thinking can be found in what the ILO calls the unpaid care work, and paid care work circle. And I'm going to be mainly talking about the green and blue sections today, but I want to recognize that all 3 are interconnected. So this circle and the social imaginaries that underpin it have many conceptual underpinnings, some of which Ido has already shared. I want to share 3. First, people are carers and workers, caregivers and care receivers in varied and multiple ways across time, with inevitable periods of dependency, interdependency, and vulnerability across the life course. Second, unpaid care work is mainly done by women. Paid care work is also mainly done by women, especially racialized and low-income women. And third, it's not only that the care economy underpins the so-called real or essential economy, they're entangled, knotted, intraconnected, and the production economy takes a free ride on the care economy. And that's from Nancy Fulbright. So this interconnectedness of paid work and care work calls for strong care and social protection policies. And I'm now at the second part of my presentation on childcare. A half-century ago, in 1970, the Royal Commission on the Status of Women called for universal daycare to support working mothers, families, and children. That call has never been heeded. As many research and social policy experts note, Canadian childcare is still too expensive, underfunded by governments, unaffordable for many families, and too reliant on parent user fees, which vary across the country, but which still eat up a significant portion of family budgets. David McDonald of the Canadian Centre for Policy Alternatives highlights a key problem with Canadian childcare. Almost half, 44% of all non-school age children live in childcare deserts. These are identified as postal codes where there are at least 3 children competing for one licensed space. These communities are parched for available childcare. And of course, things have gotten worse through the pandemic. According to Martha Friendly and Morna Ballantyne, the fact that childcare in Canada is mostly a patchwork, privately funded, market-driven, and piecemeal, yet must meet an essential societal need, is at the root of the childcare chaos brought on by the pandemic. So how could we think about childcare within new social imaginaries that link paid work, unpaid care work, and paid care work? Friendly and Ballantyne argue that accessible, affordable, high-quality childcare must be treated as an essential service during good times and bad, and must be seen as an essential part of Canadian social infrastructure. Kate Bezanson, Andrew Bevan, and Monica Lysak argue building out a childcare system will create jobs in the stimulus period, draw more women into the labor market with attendant increases in tax revenues, address significant socioeconomic inequalities and outcomes for Canadian children, and build a generational fix for deeply entrenched inequalities and social vulnerabilities revealed by the current crisis. So I want to share some recommendations from some of Canada's leading childcare experts. And these recommendations are in 2 phases, and this particular set of recommendations is from Childcare Now, led by Morna Ballantyne. Phase 1 is in this current fiscal year, and they call for $2.5 billion for early learning and childcare, ELCC, in new federal transfers to provinces, territories, and Indigenous communities to support the safe and full recovery of regulated childcare as part of the reopening of the economy. Phase 2, ELCC spending of $2 billion in 2021-22 to be increased each year after by $2 billion to move Canada towards a fully public funded system in partnership with the provinces, territories, and Indigenous governments. As part of this, there's a call that provinces and territories will be required to use the funds, these federal funds, to achieve measurable improvements in accessibility, affordability, quality, and inclusiveness. It also entails establishing and funding a federal ELCC secretariat to lead and coordinate ELCC, and creating legislation to enshrine Canada's commitment to give children, all children, the right to high quality ELCC. So I'm now at the third and final part of my presentation. Canada has a very complex parental leave system. And one part of this complexity is that it has 2 distinct parental leave benefit programs, the Quebec Provincial Insurance Program, QPIP, and EI-based parental benefits for the rest of Canada. And I want to make 3 brief points about the differences between these 2 programs. The first is about eligibility. To be eligible for benefits, a parent in Quebec only needs to have earned $2,000 in the previous year. In contrast, parental benefits in the EI program require 600 hours of insurable employment. The second is about wage replacement, the wage replacement rate for benefits. In Quebec, it is 55 to 75%. In the rest of Canada, 33 to 55%. My third point is about gender equality aims built into policy design. In 2006, Quebec introduced a 3 to 5 week non-transferable paternity leave at a relatively high wage replacement rate, 70 to 75%. This policy had a significant impact on the number of fathers who have taken paternity or parental benefits. It jumped from 28% in 2005 to 80% in 2018. In the rest of Canada, and these are the latest statistics, only 15% of fathers claim benefits in 2018. Put differently, 8 out of 10 fathers take leave in Quebec, and only 1.5 out of 10 fathers do so in the rest of Canada. Now in 2018, the federal EI program also introduced non-transferable leave, the parental sharing benefit. This is a 5 to 8 week entitlement for fathers and second parents at 55 or 33% wage replacement. There are 2 key problems with this benefit. First, the wage replacement is too low. We know from international research that to incentivize fathers' leave, especially as they are still primary earners in many families, wage replacement should be at least 70%. Second, unlike in Quebec, where paternity leave for fathers is an individual right, with the EI-based parental sharing benefit, the eligibility of the father or the second parent is dependent on the eligibility of the mother or the first parent. And so why is that a problem? Prior to the pandemic, the EI system and its parental benefits already excluded many unemployed Canadians. McKay, Mathieu, and I determined that up to 2017, outside of Quebec, an average of 35% of all Canadian mothers were not in receipt of maternity or parental benefits. Put differently, only 65% of all mothers actually receive parental benefits under EI across 9 provinces. In Quebec, almost 89% of mothers receive parental benefits. We do not have data from Canada's 3 territories. Now, during the pandemic, new measures have been put in place. On August 20th, the federal government introduced a temporary amendment to maternity and parental benefits to lower the number of insurable hours from 600 to 120 needed to qualify for parental benefits during the pandemic. In effect, parents are receiving a one-time credit of 480 insurable hours. But this is a temporary change, available only for 1 year, and questions remain about how the federal government will redesign parental benefits and the EI system more broadly to ensure that more parents qualify for benefits. And this is the last part of my presentation. I want to share with you 6 recommendations, and I'm just going to run through the first 4 quickly, and I'll say a little bit about the final 2. So first, enhance eligibility. Look to QPIP, but also look to European models with mixed benefit systems. And these are systems that include employment-based benefits and some version of citizenship-based benefits. So some version of a minimal basic income, if you like. Second, increase flexibility in leaves. Build on European models where parental leave can be taken in either one block of time or several, or on a full-time or part-time basis across several years. Third, close the gaps between parental leave benefits and employment standards legislations, that is the entitlement to job-protected leaves. And fourth, collect robust intersectional data on who is receiving parental benefits in Canada. To date, little attention has been given to the receipt of parental benefits in racialized, newcomer, Indigenous, LGBTQ2IS families, or single-parent families. And this is actually something we're taking up in the partnership grant. My 5th recommendation is on gender equality and father's leaves. Ido spoke about this as well. The pandemic has shone a spotlight on gender inequalities in unpaid care work. While men in many countries, including Canada, have increased their participation in housework and care work over the past few decades, the responsibilities for these remain largely with women. And the pandemic has revealed and deepened this longstanding pattern, as women have taken on much or most of the work for childcare, homeschooling, and education. This situation has brought to the forefront another important argument repeatedly made by parental leave scholars. Fathers' take-up of parental leave can critically shift social norms about gendered roles at work and at home. It's not a silver bullet. It's really difficult to measure, but it is a lever for gender change in paid and unpaid work. So on that note, recommendations are the following. Look again to QPIP as a model, increase wage replacement rates to 70%, make parental sharing benefit into a transferable, non-transferable individual entitlement that's not dependent on a second parent, and also lengthen leave for single parents. Not all families have 2 parents who have the option to take leave. Work towards Nordic models of equal gendered entitlement to parental leave, and set clear gender equality aims with measurable targets. My 6th and final recommendation is to link childcare and parental leave policies. And here again, we should look to Nordic models where for every child and for every family, there is no gap between the end of parental leave and childcare or early childhood learning. Now think about that. Every child has a right to parental care and a childcare spot. There's no gap. This builds on the idea of a child's right to good care, both parental care and high quality childcare. It's an ideal embedded in Nordic policy designs, especially Sweden's, which envisions parental leave as a universal right of citizenship, including a right to care, but also to be cared for. And so in conclusion, in this panel on care and social protection and in this wonderful seminar on building back better, I believe that we need a feminist and intersectional, a GBA plus approach, transformative stories and new social imaginaries to guide policy, an approach to childcare as social infrastructure where investments lead to multiple socioeconomic benefits. We need to recognize no recovery without a she-covery, no she-covery without childcare. We need an approach that conceptualizes parental leave as more than employment policy. It is a care and social protection policy and a critical lever for redistributing unpaid care work. And finally, we need a centering of care and of paid work, unpaid care work, and paid care work interactions in social policy. Thank you very much.
Thank you, Andrea. That again was terrific, and thank you for taking the discussion even further and making the interconnections between paid and unpaid work and the policy imperatives that naturally follow. I loved your quotes. Thanks for sharing Armin's and repeating it. It's terrific and something to pay strong attention to. But I also liked your other quote from Nancy Fulberg. The economy actually takes a free ride on the care economy. And the evidence that we're seeing certainly reinforces that. So I will turn it over now to Dr. Sinha. We are getting questions, so look forward to taking those and encourage them to keep coming in, and ask the doctor to take over the driver's seat. Thank you.
Perfect. Thank you very much, Janet. And again, thank you for everyone who's attending today and for Queens for hosting an important dialogue. So I'm just going to share my screen so that we can get some slides up here. So I'm just going to talk a little bit more from the take from Andrea, who's really kind of taken us to a deeper dive from the aspects of childcare over to kind of the other side of this from elder care, which Ido helped to kind of also bring in some of the issues too. And you'll see that there are many recurring themes here. And so I want to talk a little bit more about this notion of caregivers and who is caring for Canada's caregivers in particular. And so when we think about COVID-19, as many people know, that one of the populations we've been most particularly concerned about are those who are older adults in particular. And that's because most novel viruses tend to affect people who have less developed and weakened immune systems. So tends to be the young, tends to be the old, because our systems are developing in early age. They are actually starting to weaken as we get older. But people with chronic illnesses, or immunocompromised states, they tend to be the ones who can be affected. So that's what we usually expect when a virus unfolds or a new virus comes upon us. But COVID-19 in particular has had a particular predilection on the old versus younger people. And this is where we see these case fatality rates, where we see people less than 18 years of age, less than 1%. But you start seeing that when you start looking in your 60s, your 70s, your 80s, and your 90s, this is where you start seeing case fatality rates that are much, much higher. And particularly for those who are living in long-term care homes, long-term care settings, those who happen to be old, but often marked with a number of chronic illnesses and other conditions like dementia. All of these things increase their particular risk of dying, and hence why we've seen significant losses of life in those settings as well. When we look at how Canada has fared compared to the rest of the world, especially when it comes to long-term care associated deaths, this is just a diagram that shows Canada amongst other industrialized nations around the world. And what we need to know is that about 80% of our deaths that have occurred in our care in Canada have actually occurred in our care homes. And so this is something that's really stood Canada apart from many other countries around the world, where the average death rate or accounting for the deaths in care homes have been around 45 to 50%. And really, we see that there's been a really high level of death in these settings in particular, and for a number of different reasons as well. So when we think about COVID-19 and caring for older Canadians, there's really important things that we have to figure out, that several important caregiving pandemic paradigms have actually arisen in particular. Number one is with older adults told to self-isolate, family, friends, and community agencies became needed to help address basic needs, such as food and transportation. And so really there was this paradigm for those who were in the community, those older adults there. They really needed to start relying more on their social networks. And so this might have created more demands on family caregivers or friends as well in these ways. But many older adults as well and their families requiring home care no longer want to take the added risk of accessing external care supports. So I have several patients, for example, who just didn't really feel that they wanted extra people coming into their home beyond those in their social bubble, for example. And so this is where they determined that they were going to decline accessing the daily visit from the personal support worker or the physiotherapy, etc., because they just didn't want anybody else coming into the home. But then that meant that they actually had care needs that had to be addressed. And in some cases, they didn't get addressed at all, or these extra care needs would fall upon family members who are part of their social bubble, if you will. We also know that a number of families no longer wanted their loved ones in nursing or retirement homes, just given the rates of death and outbreaks that we were seeing. And so we actually had a number of provinces like Ontario, for example, back on March 24th, changed its guidance, allowing families to remove their loved ones from care without penalty, saying to these families that if you want to remove your loved ones from care, you can take them out of the home. And then when you want to bring them back into the home, for example, they would be fast-tracked back into that same home if families wanted that option. And we've never had that policy or legislative option, and other provinces created more flexibility. But of course, bringing someone out of a home is the question you have to negotiate is, how will those care needs be met outside the home? Does that create an additional burden on family and friends? Are there actual caregiving resources, paid caregiving resources external to the home that can be provided in the individual's homes in the community as well? And we also know that many families and friends were already balancing caregiving duties and were likely having increased demands on their time. And I think Ito's charts basically showed that we did actually see more caregiving duties occur. And often this was being borne more likely by women as well. So one of the things is that when we start thinking about national policies or national strategies, some of the work that I've been working on for a number of years around is trying to promote the idea of the need for a national senior strategy and really focusing around 4 pillars of activity. But one of those pillars that we like to focus on is just that important recognition of caregivers. And this is where we're talking about family or friend caregivers in particular, and making sure that we're thinking about them. And some of the reports that we have done beyond our national senior strategy include one that focuses on why Canada needs to better care for its working caregivers in particular. Because when you look at those people who identify as being unpaid caregivers, for example, we have about 8.1 million Canadians have provided care to another person within the preceding year. So that's a significant number of Canadians doing this. And 30% of these people who identify themselves as caregivers are members of the sandwich generation of caregivers. So we're talking about millions of Canadians who might be caring for children, providing unpaid childcare, if you will, but then might also be caring for an older person in their families, maybe a parent as well. And so it's a significant group when you think about it, because also you might think that these are also people who might also not only have these dual caregiving duties potentially, but they also might be balancing work paid duties as well. And so we know that 35%, or 1 in 3 employed Canadians, are actually balancing caregiving responsibilities with their working responsibilities at the same time. So you can imagine that there's significant strains on people's time, and something we need to be amounted for. When we talk about the gender issues, when you think about caregiving from that perspective, as my colleagues just mentioned, we know that women are more likely to spend 20 hours or more per week providing care. And women in Canada, according to some of the Stats Canada work, represent 54% of caregivers. So it's almost a 50-50 split, if you will. But it's interesting that when you look into that data, we'll see that 20 hours or more is kind of what women are more likely to be providing, while men on average spent less than 1 hour per week providing care. So that's really important to understand, that while there might appear on face value, kind of a 50-50 split, if you will, there clearly is a gender balance issue from this perspective. And we know that then this impacts women, because if you're a woman who's providing this amount of unpaid care, and you might actually be a member of that sandwich generation as well, you can imagine that you're more likely to be the gender, if you will, that is going to be taking off time to provide care, for example. And then this actually affects our economic productivity and, you know, a person's ability to actually save for the future, for their retirement, etc. Because women tend to reduce their work hours more so than men. They're more likely to work more part-time, retire earlier, or leave work temporarily to become caregivers as well. So the other challenge is when you think about the amount of funding we actually have, when you think about what we actually pay as taxpayers and what we actually spend both publicly and privately on care in Canada, we know that right now that still we have 430,000 Canadians who currently have unmet home care needs, while over 40,000 are on nursing home wait lists, and about 38,000 just alone are in Ontario, according to Ontario's data. And so you can imagine, when we don't have enough care in a person's home or in the community available, obviously that's going to be putting pressure on people to move into a nursing home or residential care facility. And often we have reports that are coming out from CIHI, or Canadian Institutes for Health Information, that only a few years ago said upwards of 22% of people moving into care homes probably could have been supported with existing home and community care resources. But you can imagine that even more potentially could be supported in their own homes and communities had we actually had more home and community supports available, and potentially more supports for caregivers as well. In terms of the costs, in terms of what we actually spend in hard dollars on public and private or public care in nursing homes and private homes, we know that currently the costs are about $22 billion right now, and will rise to about $71 billion just over the next 30 years. And that's in relation to the fact that we are rapidly aging as a society. Our baby boomers are about to turn 85 10 years from now. They've just started turning 75 years. And we know that 1 in 3 people older than 85 is living in a residential care setting. But we should also think about 1 in 3 older adults older than 85 has more care needs than, say, a younger person as well. So this is why we see, when we look at just the costs, if we do nothing differently, this is actually going to be the care, the amount of paid care we need to provide to keep up with our existing levels, if you will. But you can imagine the burden that this will place on unpaid family caregivers. And so through the modeling that my colleague, Dr. Bonnie Jean McDonald, did to actually model out the future and also take a look at variables that relate to the fact that we have declining fertility rates. Families are having fewer children, and fewer children might mean fewer available unpaid caregivers around. We know that between now and 2050, there'll be approximately 30% fewer close family members available to provide unpaid care. So if that's the case, we also know that by 2050, the average unpaid family caregiver will need to increase their efforts by 40% to keep up with the care needs of their family and friends. And more than twice the number of Canadian seniors will find themselves drawing on unpaid support. So we have a challenge here, is that we actually have a window to the future of what the demand from caring for older adults will need to be. And yet we actually, this precious resource that we do have of unpaid caregivers that currently are challenged, are going to be in shorter supply. So in this sense, something's got to give, and we have many aspects of our system that are currently not sustainable. So when we think about challenges faced by older Canadians, one thing that we know is there are 3 things that I want to focus on. One is just we still have many who tell us that they lack an understanding of what is available and how to navigate it. And this also extends to their caregivers as well. People don't necessarily know what are the government resources that might be available, or what are the private resources that might be available, and how do you actually knit these things together to support yourself to stay independent or age and place. And care that is available, as I mentioned before, doesn't always provide the flexibility and choice that Canadians are looking for, either older people who are care recipients or their families who are providing caregiving support as well. And care recipients and providers have diverse needs and views. We know that there's no one size fits all, and certainly that receiving care and giving care are very personal things, and often they're influenced by so many different aspects of who we are, our cultural backgrounds, our own expectations, the lives that we've lived. There's so many different factors that really create divergent needs and views. When we look at the challenges faced by paid care providers and unpaid caregivers, we see that for those who are providing paid care, and this was already focused on, tends to be a more dominantly female and racialized workforce. We know that we have significant problems recruiting and retaining staff in these settings. In Ontario alone, for example, and across Canada, but in Ontario alone, prior to the pandemic, 80% of long-term care homes were telling us that they were actually having trouble recruiting and retaining staff prior to the pandemic. And certainly in Ontario and Quebec in particular, there's been huge challenges, a huge exodus of people who have been as paid care providers within the long-term care and retirement home sector. And there's been this huge push to try and recruit new people with higher wages, incentives, things to try and bring people back into the system and to regain their trust. We know that part of the challenge is that there's often burnout that's experienced due to understaffing, inadequate training, inadequate supports, and stress. And we've heard a lot about this more recently in the media and through scholarly work. And often this is not easy work. Whether you're a paid care provider or an unpaid caregiver, there is an increased risk of having injuries, back injuries or other injuries in terms of providing heavy duty care, but also there's the risk of violence. And where we point this out is that 70% of people living in care homes, for example, and many older adults are living with dementia. 50% of the people living in care homes with dementia have what we call behavioral issues. And that could be agitation, that could be things that create a violent exchange, maybe not purposeful, if you will, but certainly can lead to more workplace injuries. So this is not easy work, especially in an understaffed and undersupported environment, if you will. And when we look at those challenges for unpaid caregivers, we recognize, and I think my colleagues have already really stated this quite clearly, caregivers or unpaid caregivers really remain largely invisible, and their roles remain inadequately recognized. One of the things that we are hearing more and more about is that by shutting family caregivers, if you will, out of care homes, we saw that a lot of residents, I think we failed to recognize how much unpaid care was actually even occurring in nursing and retirement home settings, for example. Family members that would come in to provide dressing, bathing, or even feeding support for their loved ones. And by not being able to go in to homes, for example, during the pandemic, we're really finding their ability to be unpaid caregivers significantly limited. And this is part of the challenge. We have good data saying the average person in a care home gets X hours a day of care from paid care providers, but we haven't done a great job trying to recognize the amount or quantifying the amount of unpaid care that's actually occurring in residential care settings. And similarly, we have some ways to quantify the amount of unpaid care that's occurring for people living in their homes and communities. But again, caregivers still remain largely invisible. Their roles haven't been clearly defined. And by not clearly defining that, we find different definitions and different abilities to qualify for certain supports that exist at a provincial and federal level. The current lack of support for working caregivers will affect Canadian economic productivity. Many workplaces may not be aware that 1 in 3 of the folks who's working there actually might also be an unpaid caregiver. And not being able to bring your whole self to work to say, this is also part of my reality, and how do I actually provide more flexibility to employees, for example, or other supports to at least recognize and support, can at least allow us to better retain folks who sometimes feel that their only choice is to retire early, to forego a promotion, and that certainly can impact our economic productivity. Our healthcare system is difficult for caregivers to navigate, as I mentioned before, and there are significant financial, but emotional and physical costs of being an unpaid caregiver in Canada. I think a recent CIBC report said that it's at least $3,000 to $4,000 a year out of pocket that an unpaid care provider might be having. And finally, that caregivers are not usually provided with any formal information or training to support their caregiving responsibilities. So this just really reflects a little bit of some of the challenges that we see when it comes to thinking about care as it relates to older adults. For any information related about what I've talked about, you can certainly go to our Ryerson NIA website, where you can see our COVID-19 long-term care resources, including some of the work that we've done around long-term care, and long-term care being that full spectrum, home and community to nursing home care. And I just want to thank you for your time. And I'll pass it back over to Janet and the team at this point.
Thank you, Samir. That was fascinating. And you certainly have highlighted for us what can happen as a result of our undervaluing our care economy in the tragic results that we've seen within long-term care and to a lesser extent, I would say, in retirement homes. You also described the personal, societal, and community impact within Canada, so a little closer to home. And although the challenges are pretty substantial, they do point us in the direction of some good policy options as we go forward. So I do have some questions here, very much. So we'll go right to questions that are coming from our participants. And the first one is related to the revaluing of the work of care. And the question is around what policy solutions you would recommend to revalue the work of care. I'm not sure if there's one of you who'd like to start with that, take that on.
Maybe I could do that because I mentioned about the need to revalue the work of care in my presentation. I think this is a really good and important question, but you know, actually it's quite a difficult question. I think it's a sort of to revalue care. I think it has to start from all of us really thinking that a lot of care work that people do, particularly the unpaid care work that people do, is actually work. It's not just care. So I think we need to start with a change in our mindset about what is care, and to really understand that care is work, it's a labor. So that's one. I think it also then from there, we need to also understand that work of care is actually a very skilled work. Many people, many researchers, both in childcare and long-term care sectors have said, you know, the skills that's involved in providing care is extremely sort of nuanced, requires both personal, interpersonal, physical, as well as emotional sort of understandings. And so I think we need to really start understanding sort of and rethinking the skills that goes into care work itself. More practically then, once we understand the skills involved, then I think we could have a much better sort of matching of the wages for the for the care. So, but in a more practical manner, I think what we probably need both at national and provincial level is really to establish some kind of commission or study panel to study the value of care and care work and see how it better represents in the labor market.
I'm just happy to build on Ido's comments there, that I think the other aspect is when we start, you know, there are many areas that I was pointing out, for example, like when we think about family caregivers, going into a home, for example, and providing that. This is an example of just one of those things where I don't think we actually have a number to say how many residents, whether it be in a group home, a retirement home, like any of these residential settings. I just think it was nice to see, but I think we always thought them as just visitors and not, I think, as Ido was saying, providing very skilled and necessary work at times. So I think that's partly where we can quantify this. But I also think there's this notion of a bit of a double standard, because when we see with some of the Scandinavian countries have been very good about recognizing this as work, and recognizing that, for example, if someone takes parental leave, for example, you won't get you'll still actually not, it won't actually negatively impact your Canada pension plan contributions. But there are people at the other end, for example, who might take time off work to provide unpaid care for a loved one, for example, for an elderly parent. And this is why we see a lot of women, for example, exiting early from the workplace, therefore actually foregoing pensionable benefits and things, and then being at a higher risk of ending in late life poverty. So some Scandinavian countries, for example, from what I understand, have actually said that if you are actually withdrawing from the workforce, the paid workforce, if you will, to provide unpaid care, this will not actually, you will still have contributions going towards your Canada pension plan, if you will. So I think it's making sure that we don't actually have double standards as well when we start recognizing this, as Ido was saying, as work. And work that needs to be recognized so that it doesn't unfairly negatively impact a person's retirement or future as well.
Thanks, Samir. I do have a question for Andrea.
Okay, I was going to add a little something there, but I can skip it if you want.
No, go ahead if you'd like.
Well, I just want to add to what Ido and Samir said, and just it builds on what Ido said, to bring Diane Nelson's work in here. She argued in 2007 and continues to do so, that we need to recognize and revalue reduce care work, and that can be done through childcare as social infrastructure, and then redistribute care work, and that could be partly done through gender progressive parental leave policies. And I also think we need to be thinking beyond GDP in terms of how we measure what we treasure, is how some of my international feminist colleagues call it. We need to think about a measurement indicators so that we can actually measure care beyond GDP, because obviously it's not part of the GDP.
Thank you. So Andrea, the question to you is, would increasing parental leave give incentive for employers to discriminate against young workers who already have trouble finding full-time work?
So the issue of workplace cultures is a big issue in the parental leave literature. And what I have learned through the research that I've done is that younger workers and younger bosses and certain sectors, it's not necessarily the public sector this and the private sector this, they are moving, as they see more men taking leave, it begins to shift the culture. And this took a really long time in Sweden. It took decades before it was seen as a social norm. I went to Sweden in 1994 for the first time, and it just struck me even then that there were men walking around with strollers. It was absolutely shocking to see this in the middle of the day. And then through the 2000s, men would take leave together. This sent a signal to their workplace, to their bosses, that it's important for men to take leave. And that's why the non-transferable leave for fathers, the use it or lose it, means that in families, the couple, if there's a two-parent family, they say, he has to take the leave. If we don't take the leave, we lose the time. That changes the workplace cultures. And I think younger workers are going to be pushing for this, because they, from what I've heard from other researchers and in my own research, they do want more work-life balance. They want more time with their families.
I wonder if I could also add to Andrea's comment. Similarly, I totally, I think it's really important to remember the kind of policy culture change feedback effect. And indeed, I was also in Denmark in 1992 interviewing the sort of minister responsible for introducing the the sort of non-transferable paternal leave in Denmark. I remember at that time he was saying, well, I don't know how many fathers gonna take on the leave because their wages are high. Income replacement is only something like 60%. Of course, it's gonna be tough on them. And indeed, when they introduced that non-transferable paternity leave, something like less than 10% of fathers actually took. And it was not even long. It's like only 2 months. But as time went along, that sort of that became sort of more acceptable. Of course, the government have increased the wage replacement ratio. And then as more fathers began to take, that became the new norm. And so now in Denmark, I do know, over 85% of fathers will take non-transferable paternity leave up to 4 months a year when their children's born. And today, back in 1990s, when fathers took those leaves, that the those fathers who took the leaves were considered, well, maybe not so committed to the work, they're more important to be in the family. But today, if the fathers don't take the leave, people consider them, even at the work, as irresponsible father. So, over time, the policy changes sort of changes the way people think about what is norm, and that interaction between policy and culture is really, really important.
Can I add one thing, Janet? We're already seeing this in Quebec. My colleague Diane Gabrielle Tremblay has done work that shows that when fathers don't take leave in Quebec, it's actually frowned upon. And Ito, I interviewed the Swedish minister in 1994 responsible for non-transferable paternity leave. So we'll have to talk. That's pretty cool.
Thank you. That's encouraging news, by the way. I'm conscious of time, but a question for Dr. Sinha related to the disproportionate impact of COVID on higher age groups and racialized communities. And the question is, do we have any Canadian data on the intersection of these two identities?
Yes, it's a very good question. I don't know, for example, how much race-based data plays into looking at kind of with our older populations, because so many of the deaths that have occurred for older people, if you will, if you think that 90% of our deaths have occurred amongst older people, but say 80% of those deaths have actually occurred within long-term care retirement home settings. They've found that a lot of these deaths have been more related to community spread that's been occurring, and then other factors that come in, as opposed to the types of people who more racialized, say older adults in a care home were more likely to die of COVID. What we do know is, again, when you start looking, it's interesting. I've been working with some colleagues to try and look at the different factors, and we say, how much is it gender or how much is it race that's actually playing into these death rates that occur? And a lot of it really comes back to this other aspect about poverty. And if you're living in a more crowded housing environment, for example, so you might actually, in a community setting, for example, where there's a lot of people living in a crowded household, for example, and there happens to be an older person there, this is where we're seeing more of the outbreaks occurring. This is where we're seeing a lot more of that spread. And if you have an older person kind of in that milieu, then they're more likely to not only get infected, but to die as well. And again, not so much linked, say, to race or gender, but more towards economic aspects. But economic aspects are highly linked as well. So I don't know if we have enough data to give a definitive answer on that, but I think that hopefully just gives a few more insights, from what we know so far.
Thank you. That's great. I'm conscious of time, so I'm going to wrap up and just restate the obvious, and that is that there has never been a more important time, certainly in my history, to look at social policy and potentially accelerate it carefully. What you have done, I think, very successfully is build on the messages and the information from our prior speakers, but also allow us to nudge the discussion forward and our thinking forward towards very tangible and doable solutions. So thank you for that. I appreciate it. You've been an awesome group to work with, and really hit your timelines and the expectations of our audience. So thank you so much, and I'll turn it back to Margaret.
Thanks very much, Janet. And thank you to Ido, Andrea, and Samir for giving us so much to think about, for really deepening our understanding of these issues. You left a lot on the table for us to continue to discuss, lots of recommendations. So this has been a wonderfully stimulating and evidence-rich session. So, and thank you to the audience. There were a lot of questions. I'm sorry that we couldn't get to all of them, but thank you for participating. And please come back tomorrow, because tomorrow we're going to, again, build on some of these same issues. We're going to be focusing on rethinking labor protection. So as we all know, in recent years, with technological change and the changing nature of work, it's really put a spotlight on issues related to employment standards and labor protection issues. And then the pandemic crisis, the economic crisis, have just thrown these issues into even starker relief. It's really exposed gaps in employment standards and health and safety provisions for, particularly for part-time contract migrant workers, often those we talked about today in essential services, those working in the gig economy. So tomorrow's session, we're going to dig into these issues. We're going to explore what we've learned from this crisis about labor protection and employment standards, and what the policy priorities should be going forward. We have another terrific panel. Janet Berg, who's a senior economist at the ILO, the International Labor Organization. Reference was made to some of the ILO's work today. And Kevin Banks, who's the director of the Queen's Center for Law in the Contemporary Workplace. And the panel is going to be moderated by Armin Yelnissen, who was referenced today, who's the Atkinson Fellow on the Future of Workers at the Atkinson Foundation. Armin has been doing a lot of work on this crisis, particularly related to the She Session, She Recovery, and childcare. She's also very expert on issues related to the future of work, which is her post at the Atkinson Foundation, and she's on the forefront of the discussion of many of these issues. So we'll be in great hands tomorrow with that panel and with Armin moderating it. So please join us. Please use the same unique URL that you received in your confirmation email, the same one you used today to sign up. And you can keep using that for the other sessions, because it's just gonna keep on being great. And before closing, I'd just like to acknowledge again and thank our sponsors, Employment and Social Development Canada, the Ministry of Children, Community and Social Services in Ontario, and the City of Toronto. So hope to see you again tomorrow.